afternoon everybody, karibu sana to my YouTube channel. This is Regina Jonas and it's another interesting day. We have a topic. It's about health, it's about taking care of you, it's about taking care of your babies, it's about knowing things, it's about learning, it's about moving, it's about everything in this channel. So guys, if you're new here, this is Regina Jonas. Please subscribe, please smash that button, subscribe and like my videos. Thank you for supporting me so far. Thank you for always viewing my videos, those who have already done so. And today I have an interesting topic on how to burp a baby. Yes, to my eloquent pregnant mothers, newborn mothers, yes, this is meant for you and everybody else out there on how to burp a baby. It's always overwhelming when mothers ask you, how do I burp a baby? How do I achieve this? Does the baby burp? Or what if the baby does not burp after me doing this and this? So guys, all that is covered and taken care of in this topic. So watch to the end and like and also share. Yes. And so guys, we are just about to see how we can be able to burp a baby or to enable a baby release air in their stomach after feeding, after being cranky, after crying and you don't know what is happening to the baby. So guys, tune in, watch to the end, and I'm sure we are going to learn a lot on how to handle a baby. A newborn baby is somebody who is so sensitive. We handle with care and make sure you always understand their communicating language. When they cry, they need this. When they cry, they need diapers changed. When they cry, they are maybe being fussy about being uncomfortable in one way or the other. So it's always good to understand your baby's language. So burping up a baby has two techniques which we can use to do this. And this is one, holding the baby over the shoulder like this, just above or at your shoulder point, where you can be able to see the baby's face as you burp the baby, so that you don't you're able to see what the face of the baby when you're doing this. So you can do in this position, or you can do it on the lap, over there on the lap. So meaning you hold your baby on your lap when seated and do it also in this manner. And you can do the burping or the rubbing of the back of the baby with your palm, just gentle, or you can use the patting method, also gentle. Yes, again over the shoulder, slightly where you can see the face of the baby, and then rub the baby's shoulder, gentle, or pat the baby's shoulder, gentle. You can do this when seated, you can do this when standing. It depends on how comfortable you're feeling. Yes. And if the baby does not bark or you don't hear the sound, it's fine. Just hold the baby and make sure you take some time in this position, so that if the baby has not swallowed some milk and it's going to come down into their stomach. So if they don't bark, don't worry, don't stress out. Again, if the baby tends to vomit or to spit out some milk, don't worry, don't stress out, it's okay. The only time you worry is if the baby has a projectile vomit, that is, throws out a large amount of milk, which could be greenish, brownish, or even red. In this, you can always talk to your doctor, talk to your pediatrician, talk to your nurse who is taking care of you and your baby about this. So, and if the baby tends to throw up or to vomit, do not panic. Just take the baby down a bit and look at the baby from this view, because you're able to assess how the baby is breathing, how the baby is vomiting. So if there's anything you can worry at that time, you're able to see. And if the baby is just having a reaction of being so full or has taken a lot of milk, of course they will release that by just spitting out a few. It's okay. So Do not panic by this. Just hold the baby in a position you can assess whatever content is coming out or whatever the baby is throwing out. And when do you burp a baby? Always burp a baby after breastfeeding, or even sometimes the baby is just fussy or cranky in a way. Take the baby and just see what you can do, because when a baby cries, they are trying to communicate in one way or the other. So sometimes they are crying because they need a diaper change, they need to be breastfed, or they need just to release some air from their stomach. Just take the baby, hold them in that position, rub them or pat, and help the baby feel comfortable. In this position, you can see the baby is feeling so well, so cuddled, so comfortable, and it helps the mother and the baby to bond in a way. So it's always good to take time with your baby, know the language of your baby, understand when your baby is crying what they might need. If you had changed the diaper like 2 hours ago, could be the diaper that is full. If you have just breastfed the baby and is being so cranky, so fussy, yes, they need a backup. So cuddle your baby and do as I have demonstrated in this video, and you're going to have a comfortable baby alongside you. And avoid those cranky nights or sleepover nights which you don't sleep because the baby is being again, after making sure the baby is comfortable, you have changed their diaper, you have burped up the baby is now sleeping. They need to sleep on their bed or their cot. Always have the baby to sleep on the side, not facing up, because when baby is facing up like this, they can tend again to throw up when you're not around or when you're not looking at them, and there might be a possibility of choking up. So leave the baby in a position that the baby is on the left side, comfortable, and yes, they are not able to roll back on their back, by supporting with a small cloth on the back side. As you can see, yes, you can put the baby on the left side, you can put the baby on the right side, just to enable the baby be comfortable in the way that, just like you need to be comfortable when you're sleeping. So guys, it's always good to always check on your baby when they're sleeping from time to time. Babies can sleep 3 hours continuous, 2 hours continuous. So check on them if they're fine, check on them if they have vomited maybe after leaving them comfortable. Check on them just to make sure they have not covered themselves over the face, and check if always they are sweating. Sometimes it's too hot, and when you cover them like this, they tend to be so cranky and they sweat. Leave the baby in a position or in a way that they feel comfortable, just like you could also want to feel comfortable. So guys, this has been your nurse Regina. Today has been an interesting topic about my best thing about handling newborns, about handling babies. So if you're new here, please subscribe, smash that button, hit the subscribe button and subscribe for more videos. This is a channel where we learn about taking care of babies, we learn about our health, we learn about so much in life. And yes, please subscribe and keep watching my videos. Leave a comment, like and share my videos, because next you're going to have a video on cooking. I hope you're going to like and share all my videos as we go on about learning, growing and moving with your nurse Regina.